Instruments need to soak in this solution called instrument milk. This is a non-oily lubricant that provides the instruments with a protective barrier that helps prevent corrosion. This is especially important for those instruments with hinges or moving parts. These are also spray bottle forms of lubricant that some hospitals use. When packing instruments, be sure that all small loose objects are secured and ensure that no sharp instruments will poke out. Finally, you want to make sure that the surgery packs is that either double wrapped or wrapped in such a way that it cannot be opened without causing it to become unsterile. Different things you put into the surgical pack are towel clamps, a scalpel handle and blade, a needle driver, thumb forceps, suture scissors, tissue cutting scissors, and hemostats, forceps, gauze, and sterile strip. First, you want to put down a sterile sheet, and you're going to put down your surgical instruments, and you're going to add the gauze, and then your sterile strip. When dealing with sterile suture packs, you want to hold the flap to reveal the second layer, that is the sterile layer, and you do not want to touch the sterile instruments inside so they don't become contaminated. To properly dispose of suture material, you're going to take your hemostats and you're going to pick up your suture blade and dispose of it in the shrubs container. Maintaining dental equipment. To maintain, you want to all handpieces, dental delivery units, and other dentistry-associated equipment after each patient use as directed. When maintaining dental equipment, all handpieces, dental delivery units, and other dentistry-associated equipment after each patient use as directed by the manufacturer's instructions and best practice guidelines. Cleaning, disinfecting, and sterilizing dental equipment will help prevent patient-to-patient cross-contamination. Daily sharpening after an instrument has been used maintains the active edges so that the instruments can perform the job at maximum efficiency. I will be describing a cold sterilization tray. Instrument trays containing broad spectrum disinfectants are called cold packs because they do not involve heat during the sterilization process. The disinfectant in the cold pack will need to be changed frequently to maintain efficiency. Most instruments in cold packs require 3 hours of contact time to be considered adequately sterilized. At best, a cold pack achieves near but not optimal sterility of the surgical instruments. I'll be explaining proper sterilization procedures. The sterilization process is mostly accomplished by the application of heat to instruments. Although dry sterilization can certainly kill bacteria and viruses, moist heat in the form of steam is most efficient. Other methods of sterilization include chemical and gas sterilization. The steam autoclave is the most often used machine used in the veterinary medicine. It consists of a sealed chamber that concentrates steam at high pressure to kill microorganisms. Distilled water is added to the proper level and heated until it becomes steam. Packs should be removed from the autoclave after 10 minutes. Gas sterilization is another method of sterilization often used. It is especially beneficial when attempting to sterilize equipment sensitive to heat or moisture. The sterilization gas will penetrate the paper or plastic film packaging commonly used with these units. The gas sterilization process often takes up to 12 hours depending on the temperature, humidity, and concentration of ethanol oxide. The use of anesthetic gases during surgery is not dangerous if these gases are properly administered and subsequently vented from the room. The anesthetic machine should be served regularly and the soda lime changed every 12 hours of use. Antiseptic protocols. The antiseptic technique is process of preparing and handling personal, patients, and equipment in such a way that contamination of the patient throughout an open wound or inclusion is avoided. These protocols include the proper ways to open a surgical pack and individually wrapped instruments packed in the sterile wraps. Throughout the surgery, the only person who should be touching the sterile equipment is the surgeon wearing gloves. One common accepted protocol is after an initial 1-minute wash, the surgeon begins 5 to 10 minute systematic wash with a disinfecting soap and brush. The initial scrub of the day should last 10 minutes of sequential scrubs lasting 5 minutes. What can and cannot be touched. If a sterile item touches anything that has been sterilized, such as surgery table or an outside surface of the pack, the item is now considered contaminated from that point on. This means where you are in close proximity to the sterile field, you must be extremely cautious not to touch or bump into anything. Anything that is sterile should not be touched without gloves. Things that are no longer sterile are free to be touched by the vet, tech, or surgeon at any time, such as machines or instruments once the pack has been opened.